flexion, extension, and hypertension. So look at flexion. So what is happening in flexion is we are moving, or we are trying to decrease the angle. So look at this hand. We are flexing. How? Why are we flexing? Why are we flexing? Because we are decreasing the angle. So look at the angle here now. Look at the angle in that region. So as we are trying to raise this hand, we are decreasing the angle. So that is what we call it flexion. And as we are trying to as we are trying to move towards this direction, we are increasing the angle. That's why we call it extension. So hypertension. So this is your normal extension, and this is your normal what? Flexion. But in hypertension now, what we are going to do is we are going to move not beyond our normal range. So when we are moving beyond our normal range, we now call it what? Hypertension. Flexion, we are decreasing the angle. Now look at the angle. Now when we are flexing, you see, we have actually decreased the angle. It is now more smaller. But when we are extending the angle from here to here, flexion, this is hypertension and this is flexion. So flexion, we have increased the angle. This is now totally with what? Angle 90 degrees with the horizontal ground. Why this in flexion, it is not at angle 90 degrees. It have increased. Hypertension, we are moving beyond human range. Not actually human range, but we are moving beyond our normal range. So when we are performing the movement called hypertension, we are moving beyond the human range. So we have extension and flexion. Flexion decreases the angle. Look at, we have decreased the angle, and extension, we have increased the angle. Now abduction towards the body, abduction away from the body. We have supination and pronation. So what happens during the supination, as I explained? Now this is a hand standing in anatomical position. So during supination, this is our anatomical position. So I'll call this diagram A, I'll call this diagram B, and I'll call this diagram C, so you not get confused. So in anatomical position, during pronation, you know, in supination, our hand is always in supination, our palm is in supination in anatomical position. Just imagine standing in anatomical position. So in anatomical position, if you're not understanding what the word anatomical position, just go back to my previous video on this place. So in anatomical position, just stand that erect, or just stand that way. So as you stand in that way your hand is, we call it also supination. We are supinating. So that is the way hand is meant to be, because when it now lies on the ground, the palm is now facing forward. For this reason, we now call it also supination. Why during pronation? So pronation is now when you are trying to move in opposite direction. So during the pronation, what is happening? The head of the radius, the head of the ulna crosses over the head of the radius. The head of the ulna crosses over the head of the radius, or the head of the radius crosses over the head of the ulna, because this is my ulna. Ulna is more closer to the body, and this is my radius, and it is more far away from the body. So during pronation, the radius is crossing, the head of the radius is crossing over the head of the ulna, and this is proximal and this is distal. So I call it proximal because it's more closer, and distal, it is what? Far away. So this is distal from the original. So this is distal. So when if they ask you to describe pronation is when the distal head of the radius crosses over the distal head of the ulna.